Hello again, everyone. This is Dr. Dan Bockmann. I'm a chiropractor here in Austin, Texas. I have a rehab and sports medicine clinic here. Today in our video, we're going to talk about, we're going to answer a viewer question, and it's a big one, and I get asked this frequently. It's a big concern of folks, understandably. The question is, can cancer cause low back pain? And the answer is yes, it can. I will say, however, that back pain caused by cancer is quite rare, especially considering the population of patients who come see me. I see thousands. I've been in practice almost 18 years, in my 18th year, and I've seen literally thousands and thousands of patients with low back pain. I've caught 2 cases of back pain that was caused by cancer. And those patients, we caught them very quickly, and they immediately started a treatment with an oncologist I sent them to. So no one wants cancer, obviously. It is something that's a risk for everyone. Some people have a bigger risk than others. Here, let me just give you a way to think about this, because I don't want you to immediately worry about cancer if you have back pain, which our minds tend to do. It thinks especially if we have severe pain out of the blue, we immediately think, oh, it's got to be something terrible. But cancer or infection, like a bone infection, for example, both of those things can be aggressive, scary things that can also, bad for you in many ways, that can also give you back pain. Cancer, for example, some of its hallmarks are intractable pain. That means pain never goes away and gets worse at night. Again, this is not always the case, but pain all the time, progressively worsening as days go by, worse at night, can't sleep through it, medications don't touch it very often. Infection can behave much the same way, but you're also going to have likely other systemic symptoms as well. You may have fevers, you may have nausea, vomiting, there are many different things can accompany this, but usually it's not going to be just by itself. You're rarely going to be otherwise very healthy and not having any issues, never had them before, and then suddenly get progressively worsening pain out of nowhere. So let me stress this, if you feel something seriously is wrong, go to your doctor immediately. Let's rule out some of these things. These are relatively easy to find and catch with blood work, a routine exam. Your doctor, even your family doctor, will be able to catch these things in many cases. I caught mine with an MRI in 2 days. Not my personal, but my most recent patient who had it. Caught it very quickly, got him into therapy very quickly. So yes, while cancer can cause back pain, take reasonable steps. Go to your doc. If you haven't had a physical, hadn't had blood work in a while, just say, or if you have a history of cancer in your family, let's say, or you have a history of, if you have a history of prostate issue or bowel issues, because that's where the cancer can start sometimes and spread to bones or to the muscles around joints around the back. If you have a history of cancer, or either yourself or in your family, or if you just want to make sure, go to your doc. Tell them, I want to get fully checked out. I want all my blood work done. Examine me. If you think I need x-rays, if I have a history of trauma, x-rays or MRI, let's get that. That way, once they rule that stuff, the scary stuff out, then you can sleep at night again. And then we also know the fix for back pain is likely going to be pretty simple. So mechanical back pain, which is the term for the most common cause is a kind of back pain there is. The huge majority of back pain is mechanical, which is very straightforward to fix in most cases. Meaning, just for example, my typical patient here with low back pain, we get them 80% better in 3 sessions and equipped to get the remaining progress on their own and equipped to not need to come back and see me. 3 sessions. So that's for even if they're hobbling in here, if they're in severe pain, 3, maybe 4 at most. So that tells you how quickly you can get better from even severe back pain. And I don't want you to worry unnecessarily about cancer. Always, it's better to know than to guess. So if something big or scary has happened, see your doctor. They'll check everything out. Then you can, once they can put your mind at ease, hey, this is not something big or scary, then you can start addressing the simple, easy fixes and employing some good maintenance for your back. I hope that has answered your question. If you have any questions for me that you'd like answered in the future, definitely leave them down in the comments section below. And if you like more of this kind of content, definitely subscribe, ring the bell over here to your right, and we'll see you next time you're in. Thank you very much.